This is your body and this is your carbs. When you shut this down, this goes, brain oxidation goes, inflammation goes, blood pressure lowers, ED comes back, PCOS keep it, fatty liver keeps it from simply stopping the carbohydrate train. That's it. So a nutraceutical is just bringing it back to what we did 1900s. We didn't eat every 2 hours. We rested our guts and we learned how to heal with food.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Good morning. Welcome back to the Unplugged Healthcast. It's time to wake up. It's time to get unplugged. Stop taking the blue pill. Stop taking the purple pill, the red pill. It's time to get off the pills and find some normal, logical, simpler answers to health and abundance. And we are here to help you provide some solutions and logical ways for you to get out of that. Before I get started today, though, I want to start off with some encouragement because, I've been doing health care for 36 years. And I have seen the issues that have really sucked us into this. And I had to sit by on the sidelines and just kind of watch it happen. So it's fun and encouraging to me. And I want to encourage you, if you're listening, that, man, we're living in a different world in a lot of different ways. Some bad, but a lot are really good, man. The time today that people actually take to really look and research and understand their health is drastically different than was before. We were all just living in the dark, and you had to listen to the doctor. Whatever they told you, you took for science, and it was truth, and off the time it really wasn't. We're questioning the concept of vaccines, and I'm not going down that road, but people are just looking into some of the reality. I grew up, maybe I got 7 or 8. Kids are getting 70 now, maybe 80. It's crazy. We got to consider that, and people are questioning that. They're questioning their foods they're eating. They're not just eating anything and everything. McDonald's used to be actually probably food that was a little more normal than it is today, and people understand that. Processed food, high fructose corn syrup, the way that we've modified food, altered it. People are questioning this, and these are good things. They're questioning medications. They're not just taking everything and anything they're told to do. You get a prescription, people look it up, and it's good to have information to make you better decisions. And of course, we are understanding exercise. There was a guy back in my day named Jack LaLanne. He was a guy that was the original exercise guru. He actually was a chiropractor. You probably don't know this story, but he started off as a chiropractor, became very famous, promote and produce exercise videos. And the concept back then, exercise was working in the farm, working in the yard, working out on the fields. Well, today, exercise is something most people know is normal, it's necessary, and it's part of many people's lifestyle. That's a great thing. So, do you know of anyone that's dealing with diabetes, cardiovascular disorders, disease, high blood pressure, cholesterol problems, maybe had a stroke, or maybe they're just dealing with weight issues. Maybe they're in the category of obese, or maybe they're just overweight and can't manage their weight. Do you remember there was a time in your life where you could kind of eat what you wanted and you didn't think much about it? It seemed like your body could burn calories faster than you could bring them in. Man, those were good days, weren't they? Maybe have you noticed, though, your metabolism doesn't work the same today? Or maybe it never has. Maybe you've always had metabolic issues where your metabolism just seemed to be decreased, slower than you think it should be, or slower than other people around you. Well, today our topic is diabetes and all the metabolic disorders related, because there's a lot going on in this category. So let me just give you some facts. 37 million people today in America are diabetic. Wow, that's a big number. 350 people in the U.S. exhibit signs of metabolic disorders. So outside of diabetes, we got 350 million people dealing with signs or symptoms of metabolic syndromes. Globally, diabetes is 463 million people worldwide live with diabetes. This is projected to be 700 million by the year 2045. Wow. 51% of the world's population is defined now as overweight. 1 billion people globally are affected by obesity, actually classified as obese. 1 billion people. 300 million with cardiovascular disorder, 250 million with fatty liver disease. Most of you don't even know what fatty liver disease is. You should look it up. Most of you are dealing with it, and you probably don't even know it. But if you add all those up, we got over 1 billion people globally that are affected by metabolic disorders. And I'm not sure you even know what metabolic disorder really means. For many years, I have thrown a lot of rocks probably at some of the classic big pharma allopathic treatments, protocols, and even at a few of the doctors out there. But all along the way, I always knew there was one person in that healthcare arena that was always making a difference. I love these people. I had many patients, many friends, family members in this category, and it's the category of registered nurses. Man, these people always are caring, always sitting side by side, always listening, and they're the ones I think, honestly, most of the time in the hospitals that are really healing people. Well, today, to understand how to deal with diabetes and these metabolic disorders, I have brought in, of course, a nurse. If you guys would welcome into our show, Yvette Oxford, registered nurse, metabolic health and wellness nurse educator. Yvette, welcome to our show.
Hey, thank you for having me.
Yeah, it's great to have you. Let me set this up a little bit for our audience. The road that got you here to our show today has been a bit of a whirlwind. If I recall from our conversations and information you sent me, you started off in the wellness arena, I think in the world of massage therapy, sports therapy. You then at some point became a registered nurse. Then you became a pharmaceutical rep. Then you worked in trauma nursing. But at the end of the day, you have made it full circle back to the wellness arena. But you're going to help us understand a little bit of what goes on behind the curtain that many people never see that I think you have. And a little bit of what I call the king's not wearing any clothes. These solutions we have out there today, in America mostly, for diabetes, metabolic disorder, honestly, I think they're killing us. I mean, the result is people just cut their legs off. Tell us your perspective of maybe what got you here and what took you back to the wellness arena.
So as a massage therapist, I work for the most elite athletes in the world, the Dream Team, the Patriots Super Bowls. I went from the elite, got my nursing degree, worked the floor, saw what we call repeat offenders. They just keep coming back because no one's treating the root cause. And I never saw that. And then I got into pharmaceutical sales as I begged for prescriptions for dietary diseases. I started seeing a pattern. I'm like, wait. So then I became a diabetes educator in the pump systems and the CGMs, continuous glucose monitor, and pump trainer / sales. And I noticed that no one was a person. They were an ICD code or they were an insurance grab. Let me explain.
Yeah.
Type 1 is insulin dependency. Type 2 is a dietary disease, carbohydrate toxicity syndrome. But they've labeled them in one balloon called diabetes.
Yeah.
One is immune mediated, one is dietary related. And I started noticing that we're treating the same different diseases with the same answer, and we're getting worse.
Yes.
So as I've seen bedside, ER, sales to today, helping people put it behind them, reversing the process that got them here, I'm finally winning as a nurse.
But you're not even in the hospitals anymore, I don't think.
No, I am a diabetes educator working for one of the largest, oldest companies since 1903 that was going to eradicate heart disease. This is a business and WellCare's gone. I need to find my space here. And for the last 3 years, 3 months, I finally found my space. You know, I watched my dad take his last breath. And for the last 10 years of his life, he never even left the couch. And that's just not normal. And so when I reversed my mom's diabetes, got her out of her diabetes, hypertension, obesity, she's 77. I was like, wow, this really is, it really is doable. It gives her hope.
Well, before we maybe get to kind of the solutions of how you did that, because we're going to get there and you need to hang on if you're listening. I know often people hear me, I rant a little bit, I rave a little bit, I throw a few rocks here or there about what I believe is going on in the medical world, but you were there. You were behind the curtain. Can you either tell me I'm off my rocker or maybe lean into the credence that I'm saying that the system really doesn't work very well because it unfortunately is a business. It's not really a treatment regimen.
I'll give you a quote from my diabetes educator. We know carbohydrates and sugar raise glucose, and you're going to be on a long-acting insulin at night, so make sure you eat a snack to cover the insulin. Wait, what? Instead of saying, hey, Dr. Kevin, how about we cut the carbs and sugars? Because at the end of the day, insulin is for type 1. Yeah. So as I'm watching my own CDCES educators run by the ADA, I thought, wow, this is a business. But for the fact that they just tell you to reverse where you came from, the processed carbs, the sugars, the eating every 2 hours, the no exercise, the no muscle training, we wouldn't have a business. 6 companies would go extinct if we followed 4 simple ways. 6 companies.
Yeah. And they're big companies. We're not talking little mom and pops.
I work for them. I work for one of the largest diabetes companies in the world. And when you have your sales rep chasing around after someone's C-peptide so they can afford a pump that they don't need, it's a business. Yeah.
Yeah, I think that's really where we're stuck at, is that the patients, they're struggling on figuring out how to reverse it. And they think that what they're doing is managing it. In fact, that's what they call it, managing my diabetes. But you and I know this isn't managing. Managing means you at least keep it the same or slightly improve it. If
you Google the word cure, it's just the absence of disease. It's the absence of signs and symptoms. It's the absence of, right?
Yeah.
We're not allowed to say the word cure. We're not allowed to say that because it goes against the television, and it is a very big business. If you were to ask everyone at the doctor's office, would you like to reverse where you are? They would beg you, because they use words in commercials like your CGM manages your diabetes. No, it doesn't. Ozempic, what did they say? Mounjaro is life. It's not.
Oh my gosh. Unbelievable marketing.
You can quote the television. I have type 2 diabetes and I manage it well, Jardiance. Do you see the little play on words? And so 100%. They play on your emotion. And I literally sat, Dr. Kevin, across a 35-year-old woman. She was legally blind because the number one cause of blindness is diabetes. And they were putting her on an insulin pump, and someone was going to do her pump for her. I literally sat there and go, Yvette, what are you doing, man? They had a man who couldn't read. They put him on a pump. So I saw the business part of it, and I wanted out. And I got out in July of 22.
Well, we need more people to see behind the curtain. And I appreciate you giving us just a little perspective about that. I mean, there's a lot of these medications, and of course, they come out with a new one, they rename it, they just modify it enough to, because it wasn't working, to come out with a new thing. What's the repercussion of just doing these meds? I mean, speak just the truth, because you've seen it. I see people getting their legs cut off. You just said something I'm not sure I was aware of, that diabetes is the leading cause of blindness. Did you say that?
Yeah, diabetes is the leading cause. Type 3 is Alzheimer's. The leading cause of blindness, type 2. The leading cause of tooth decay. The leading cause of heart disease. The leading cause of liver disease, kidney disease. You actually have a CKD, chronic kidney disease, but you also have diabetic kidney disease, DKD. It's the leading cause of amputation. It is a rotting disease. It will rot your eyes, it will rot your skin, and it will age you faster than anyone in a room that's the same age as you. Insulin is a fat hormone, a hoarding hormone. It's an anabolic. It's a hormone that hoards, right? So the reason that you need the water pill with the heart pill with the sugar pill is when insulin is high, so is salt and so is water. So it's just this vicious cycle. I don't know if you know this, but type 2 diabetes used to be called sugar diabetes and non-insulin dependent diabetes.
Yep.
They changed it to type 1 and type 2. Yeah, they changed it so they can make an ICD code for it, just like they made obesity and ICD now. They can actually charge people's insurance by coding obesity as genetic.
Isn't that a luxury? Yeah.
It's easy.
Yeah. And then you got a lifetime patient and a lifetime source of income while the guy just deteriorates into the abyss and his family has to watch it. What about metformin? You know, this one's the classic out there. I haven't heard you talk about that. My understanding of these meds is limited, so I'm not going to pretend I understand them all. But I hear people thinking, oh, their metformin's controlling their diabetes. That is not insulin by definition, right? And what's so bad about that?
Metformin's job is to make the body insulin sensitive. Do you know what makes the body insulin sensitive? Stop eating carbs. Metformin, I call it the gateway drug because we have what's called monotherapy, dual therapy, triple therapy, quad therapy. And if you look at the writings of the American Diabetes Association, GLP-1s are before they put you on insulin, they're going to try GLP-1s.
Right.
And then you get on insulin, short acting and long acting. So it is actually an algorithm that I had to memorize. Metformin's a gateway drug. They give it to you, lifestyle modification. Do you know what the Diabetes Association calls lifestyle modification? You are allowed 45 grams per meal in carbs, 20 grams per snack. 2 questions. How many meals do you eat a day? And how many snacks do you have? But they taught you that if you just get a continuous glucose monitor, you just give yourself the insulin. Eat, inject, repeat. Eat, inject, repeat. So instead of this and the handy dandy keychains, if you back up 10 years, because diabetes is coming for 10 years, the minute they hand you the metformin, you say, what else? When I say modify, I mean you get 20 grams of carbohydrates a day, prioritize protein, do not fear fat, time restrict your eating, and muscle training. There's no prescription in any of that, though.
Oh, they're not even close.
There's no prescription in fasting. There's no prescription. If you think about this, if you have the Food Drug Administration in one building, it's a win-win. A little additive here, a little additive here, neuropathy in the legs, here comes your med. They're in a business together.
You know, I think with this recent administration and the politics and the internet and RFK, people are really starting to come to grips that this is just real facts. And I think today, as I started our show off, that we're in a different paradigm, a different era than I started in. And I'm not sure where you, but sounds like you started similar to me in some of these time frames. People are willing to hear this, but they're not sure what to do about it. Now, I think a lot of people don't even realize they're either diabetic or they're dealing with a condition relative to diabetes, which is really this metabolic disorder. Can you speak into metabolic disorders and all of the things relative that really aren't labeled diabetes, but are just giving another med? And the answer, I think, is probably going to be the same answer you already gave them or you're going to give us at the end of the show.
So if you look at heart disease, 90% preventable is caused by diabetes. Right? High blood pressure, high glucose, high triglycerides, low HDL, and people forget about hyperwaistlinemia. Those are some things that you can literally look at yourself and go, if you have those 5 things, you don't need a blood test. You don't need a blood test to tell you that your waistline is larger than your height, because the goal is that. So at the end of the day, if we were to teach, as we were taught years ago, how dangerous sugar is, it goes to the dopamine receptors of the brain. It literally goes and burns your brain like the top of toast. We would not be where we are. And there's a simple change they made. They went from the cubes, do you remember the sugar cubes? To bags. So you don't even know how much sugar you're drinking. They know what they're doing.
Yeah. Because
1 sugar cube is the amount of sugar that runs the human body at any given time. 4 grams of sugar is all you need to run your human body. Yeah. There's no dietary need for carbohydrate consumption. There's no dietary need for sugar consumption. They have convinced a world, the 3 macros, you have to have all 3. There's not a dietary disease from not eating carbohydrates. Not one. There's not one. But the wheel of despair is the osteopenia, the sarcopenia, the migraines, ED, PCOS. People don't think about infertility and erectile dysfunction being part of insulin resistance, right? They don't think about Alzheimer's being type 3. It's the oxidation of the brain from too much sugar just floating around freely in your brain. That is amazing. If I knew what I know now 10 years ago, my father would have lived 10 years of quality life.
Well, that is a painful thought that all of us probably can go back to. If we have a loved one in the last 20 years that died, chances are they were this. I see those old pictures of people on the beach back in the 70s, right? And the people on the beach today, and holy mackerel, we have lost our way. We got to give them some solutions here. Insulin resistance, hypoglycemia, weight, gastrointestinal organ damage, neuropathy, cardiovascular, all of these things have different names, and what a great way to create a new pill. But at the end of the day, I think what you just said is the answer is a sugar cube. It's almost that simple, that if we just stopped the madness, measured and or reduced our sugar down to that level, would people really heal, or how do people really get out of this?
The minute sugar hits your tongue, it's like a light switch. Insulin turns to fat storing, right? When you turn insulin down and keep it within normal limits, not glucose, insulin, the light switch turns off and your body turns and it starts burning its body fat for fuel. See, the problem is 1977, the food pyramid came, and then they said fat is bad for you. So we went to the Entenmann cookies and the fat-free cookies. Fat is the first thing your body garbles when you eat it.
Yeah.
But if you eat carbs, the first thing your body burns is carbs. The second thing is protein. The third thing is fat. So just flip the switch, prioritize protein, do not fear fat, learn how to time restrict your eating and therapeutically carb reduce or simply omit. If you are in the inertia of the 93% that are sick, you can have 20 grams a day, not a meal, a day. So to give you some perspective, one piece of bread has 15 grams of carbohydrates. Yeah. The minute that your body switches fuel sources, because we have two fuel sources, we have carb fuel and we have fat fuel. This is your body and this is your carbs. When you shut this down, this goes, brain oxidation goes, inflammation goes, blood pressure lowers, ED comes back, PCOS keep it, fatty liver keeps it from simply stopping the carbohydrate train. That's it.
Wow. So you just put erectile dysfunction businesses out of business. Are you telling us that those conditions are relative or can be resolved from just what you described?
Yes. You have something called vasodilation and you have vasoconstriction. Vasoconstriction is a vessel that's closed, or bronchoconstriction. Nitric oxide, to put it in a third grade, when nitric oxide leaves because you're insulin resistant, your vessels close. ED, no blood flow, no man.
Yep.
Constriction, blood pressure. So they're one and the same, right? It's that vasoconstriction, just like watering your grass with a kinked hose. It's the same thing as your body. Fix the inflammation, vasodilate, blood flows. I mean, it's that easy that we are called quackery, because in the last 50 years, they think that nutraceutical and chiropractic is quackery, but they've said it enough that people believe it. Sadly.
Yeah, well, welcome back to my world. I know you started working with a chiropractor years ago, and now you're back in the category. And you're quackery if you just suggest anything different than Big Pharma says. But right now, again, I think people are willing to hear. People are listening. I want you to finish with two things. One, you talk about nutraceuticals. It's kind of a biohacking term that's getting more popular, and people are, but define what nutraceuticals really are. And then after you do that, I need you to talk to all of us like the nurse educator you are and tell us, how do we get the world out of this problem?
So if you think about pharmaceuticals are chemically made by a man, a lady in a lab, and they are trying to mimic what the human body needs, right? Right now, the big hot thing is GLP-1s, peptides. Everyone wants a GLP-1.
Yep.
But if you sat for 5 minutes, you produce it in your own body. Yeah.
Right.
The reason that nutraceuticals and herbs and plants and vitamins and minerals don't make you vomit, nausea, diarrhea is because your body works in synergy with it. When you put a foreign substance in your body, the first thing your body wants to do is get it out. So a nutraceutical is just bringing it back to what we did 1900s. We didn't eat every 2 hours. We rested our guts and we learned how to heal with food. Because food is medicine, medicine is food. Now we've reversed it. Instead of treating the root, we're just treating the symptoms.
Sure.
And it's creating a business. But if you would just get down to a fever is a signal that your body's not working. Obesity means you're just swimming in insulin. So what a nutraceutical is in my world is using a plant-based program with fasting, carb restrictant, muscle training. And we are seeing people with A1Cs 11.5s to 5s, my mom. You're seeing it in lipid panels, you're seeing it in waistline, and you're seeing it on the scale is secondary to changing the way you treat disease.
So is that what you would call a metabolic reset?
Yes. So when someone says they want to do a reset, simply stop eating every 2 hours, alter your fast 18-6, 16-8, 24, 24, 36. To increase human growth hormone, stop eating. I mean, people want more muscle, stop eating every 2 hours and you'll get like a 2,000% return. Number 2, gut reset. Brain and gut are the same, right? You got 2 brains. You want a gut reset, stop eating. I've never, ever seen a dog overeat when they're sick. Yeah. We do. So reset your body, bring your insulin down naturally, bring your glucose down naturally, and watch the harmony of your body. Our bodies are innate and know what to do when it's sick. But we have gotten so used to this, I can eat what I want because they're going to save me. And that's not, it's getting to the point where we have 640 million will have type 2 in 2030.
Yeah, those stats I started off with hopefully would be alarming to most. I think we've just all kind of heard the noise, and most people are just so used to this hum that they don't even hear what we're saying. But we're going to keep saying it. We're going to keep preaching it. If you don't mind, how do people find you? By the way, if you are listening to this podcast, you need to go to YouTube and watch it, because Yvette was using a lot of models and some graphics and some illustrations along her conversations that I think if you saw what she's talking about, you'll understand it more than just hear it. But if they want to find you or have you help them, can they link up with you? Can they find you?
So Unicity is 1903 Rexall Drugs, the nutraceutical that got squashed by a billionaire. Yeah. So we went from plant-based to petroleum-based, or you didn't get funded. That's a fact. You can look it up. It's called the Flexner Report. In the 1990s, a man bought the company. His name is Stuart Hughes, and he revamped the company, changed the name to Unicity. It is literally a nutraceutical, a plant-based, yerba mate-based mate, and a fiber matrix that, quote, in the Cleveland Clinic is the only natural way to reduce triglycerides, raise HDL, and stop food noise. We just got a report back that Unimate alone increases your own production of GLP-1 70%. So instead of using chemicals, use your human bodies. Protects the liver, increases muscle efficiency. And what I like is it increases the ketones, the fat on your body, for energy versus sugar. Because I'm 55, my brain needs ketones to keep me from having the Alzheimer's, the dementia, the brain fog. Women over 40, ketones are for your brain. So they can always find me. I have a page on Facebook called Healthy Guys and Gals of Huntsville. Yes, Guys and Gals of Huntsville. I have 3 TikToks. I also have my own You Feel Great page as well.
Are you struggling losing weight? Do you need a metabolic reset? Are you concerned about diabetes? Hey, it's Dr. Wall here, and it's time to take action. It's time to get unplugged. Here's the simplest solution I've ever seen for losing weight. Reset your metabolism, reduce your A1C levels, and reverse your type 2 diabetes. It's time to feel great again. Hit the link in our show notes or go to drkevinwall.com and learn more about our Feel Great system. This product curbs appetite, reduces your cholesterol levels, increases your HDL levels, and supports normal blood glucose levels. It can increase your GLP levels by 70% when fasting. You don't need Ozempic. It's time to take control of your health again. Hit the link in our show notes and watch the belly fat melt off.
I think that you're speaking hope into a world that honestly I think they can't get out of. So these 2 products, that Unicity, is that the company?
Yes.
People who are in obesity, in heart disease, in cholesterol, taking medications, can they just buy these products? Does that help them get out? Because most of them, they can't get the willpower. They're so deep in the hole, they can't imagine how they're going to get out.
The system empowers you and gives you hope. Balance goes in your body and opens the stretch receptors for your brain and tells your brain you're full. It restores leptin, the hormone that says you're full. It will go in and stretch receptors like eating 10 apples before dinner. It slows digestion. It slows carb rise in sugar, glucagon letting go of sugar. I've never seen cravings go away faster. Mate gives you a calmness, reduces oxidation of the brain, stops food noise, and actually is the only nutraceutical for GLP-1 and metformin. So we talked about metformin. Same mechanism action, increases insulin sensitivity, decreases insulin resistance, and fat falls off your body. Because that's really the end of the day. It's the visceral fat in the fat.
Yep.
I don't think that we should be so focused on the scale. I think you need to be focused on metabolism and your metabolic health. That's my goal.
This is a program that if you're out there and you're dealing with weight issues, cholesterol issues, cardiovascular issues, PCOS, erectile dysfunction, and or diabetes, or know somebody, you've got to look this thing up. You've got to check out Yvette, and we're going to leave this in our show notes. You got to go check her out, and you got to find a way to get out this thing sucking you in, and the high carbohydrates, reduced ketones, all of this you've heard about. You know it's true. We're not telling you something you didn't know. We're just giving you a simple exit point. As we say in this podcast, health is simpler than you think it is. And here is one simple decision you can make tomorrow, and you can start getting your diabetes under control without all the crazy medications that are really just killing you.
If you check me out online, I do a lot of lab reads for my customers. I have the largest medical team for Unicity in the world. Jason Fung's coming to speak at our convention. Nina Tai Colt, Mindy Peltz just did something for us. I will read labs. I have education courses, and I also teach you what to ask your doctor. I have 7 things I teach my patients to ask their doctor, and they're doing it.
Well, this is exactly the beginning of my show. People, you have resources that nobody had in our days of old. Our ancestors never needed it, but they never had it even 20 years ago. So here she is willing to help you. I think you're crazy if you don't consider checking her out. Is there a symposium or a conference that you have coming up people can attend, or is that only for the providers?
November 8th in Orlando at the Marriott Grand Hotel, the Monster. I can't believe the people that will be on stage in Orlando. Jason Fung himself is a nephrologist who's saving lives. Because I think what we're trying to teach you is stop outsourcing your health.
Yes.
Stop letting someone else tell you how your life is going to be.
Amen.
Take it back. And that's what my company gives you. Again, the empowerment and the hope to stop outsourcing your health.
All right. And if they can come to this thing, anybody can come to this thing?
Yep.
All right. And they can find that on your website or Unicity.
Yes.
All right, guys. Well, there you go. We're trying our best to wake you guys up, give you some answers, and get you to take charge of your health, because that's basically what she just said. It's within your grasp, and that's something you need to hear. That's a statement of hope for you. It's within your grasp. I don't care how bad you think you are. There's hope for your future. So, all right. Well, this is Dr. Wall and Yvette Osborne. We're going to sign off today from the Unplugged Healthcast. Thanks for joining us. Do remember, share this with friends and people. Go online if you want to get information about this and find Yvette on the show notes or on our website. We'll have that there for you. But always remember, be healthy, be blessed, never give up, and never give in, even if you have severe diabetes. All right, we'll see you again on the next episode of the Unplugged Healthcast.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.